So let's just go back and review. SB276 is the bill that Senator Pan introduced that it's supposed to take care of people physicians writing fake medical exemptions. What it actually does is much, much more than that. It removes the physician being the one that has the final decision on the medical exemption and puts that in the hands of a state bureaucrat. It also curtails what medical exemptions can be written for. This bill, SB 276, will curtail that and will make it only CDC contraindications and precautions. Now, it was expanded in the last round of amendments that Senator Pan had to include the AAP and ACIP medical exemption criteria. And the interesting thing is, none of those three bodies have medical exemption criteria at this point. And so, what they do have is vaccination guidelines. So basically guidelines that doctors can follow to determine whether or not they should write a medical exemption, or whether or not they should vaccinate. Not that they should write a medical exemption, but that they should vaccinate. And so, but those are just guidelines, and ultimately it's up to the physician. And the CDC has said to us, we have emails documenting that this should just be a guideline for the doctor. The doctor is ultimately responsible whether he vaccinates the child or thinks it's appropriate or not. So the wording in the bill actually doesn't match anything. There are no medical exemption criteria, but if we go with the CDC guidelines for vaccination, then it restricts it completely. Things like having seizures after vaccines wouldn't be counted as a good enough reason not to vaccinate further. There are other things that are in the bill. There's a rule for review. So the medical professionals that write medical exemptions, if they write 5 or more medical exemptions, they will be put under review. Now, there's no definition of what that review is. There's nothing that says whether it is, that your 5 medical exemptions that you've written that year are reviewed, and yep, you got checkpoints for all of them, you're good to go. You can write as many as you want after that, and that's the review. It doesn't say whether every medical exemption after that will be reviewed. It doesn't say whether all of the ones from previous, years will be reviewed. It doesn't say anything. So the doctors that are involved in this are really concerned with that, because they equate it to an audit. So, if you knew at point number 5, if you submitted the 5th thing to the IRS and you think you've done everything right, would you really submit that 5th thing if you knew it would trigger an audit? You wouldn't, because you wouldn't want to put yourself in that position. And the number 5 is this arbitrary number that doesn't associate itself with anything. A doctor could have 5 patients in his practice. A doctor could have 5,000 patients in their practice. Well, those are going to hopefully warrant different number of medical exemptions, because we already know that 2.6% of the population has vaccine reactions. That's according to the Harvard Lazarus study. The other place that triggers review is if a school is under 95% overall vaccination rate. Well, many schools are under 95%, but actually have 95% on all of the individual vaccines, because the way the overall rate is calculated is that it is, if you are missing one vaccine, then you're considered not vaccinated. So somebody could be missing a hepatitis booster shot and they would not be considered vaccinated, and so that their number in the overall rate wouldn't be counted. What we've suggested is that they use the contagious diseases, so measles, mumps, rubella, chickenpox, and whooping cough. And if those numbers are below 95%, because realistically it doesn't matter if somebody's not vaccinated for hepatitis B in the classroom, that's not going to affect the other kids in the classroom, from a contagious disease standpoint. So that's the summary of the bill. There are many other issues with it, and if you go to avoiceforchoiceadvocacy.org/SB-276, you can see our full list of concerns with the bill. That's sort of the major overview, and I would say that it was heavily amended before the Health Committee and during the Health Committee, but it was amended to leave it that it is an extremely unfunctional bill. So if it does pass, if this bill were to pass as it is tomorrow, there's just no way that it would be able to be implemented effectively. They'll implement it. The other thing that I will say is that the regulations, so most bills, when a bill becomes statute, when a bill becomes law, you then go through the regulatory process. And what that is it's a public comment process where they sort of define minutiae of the bill and go through, what does this actually mean? What are the restrictions? What are the criteria? What are the this and that? This bill, because Senator Pan wants to rush it through and rush it to get approved and out there, this bill actually in its wording says that we don't have to go, that this part of the statute will not go through the regulatory process. So he's taking out a whole administrative piece of it, which means that, if you're taking out an administrative piece, then you have to have what would have been in the administrative piece in the bill. You have to be extremely specific in the bill, and this bill is so unspecific.